Hello, good afternoon.
And hi to everyone at home. We're going to begin with a question from Ryan Belmore of What's Up Newport. What can restaurants, stores, and other non-essential customer-facing businesses do right now, while closed, in order to be best prepared for the new normal for when you do give them some kind of green light?
Yeah, it's a really good question. So while we don't know exactly what the new regulations will be, and by the way, we're in heavy discussions with restaurant owners and hoteliers and such to get their feedback, hairdressers and the like. There are a few things we do know. We do know that there's going to have to be some version of social distancing for the next year or until we have a virus or a therapy. So start to think about how you can change the layout of your shop or your restaurant. Maybe you're going to have to take tables out, but just figure out a way. The rule of thumb of people being 6 feet apart is still a good one. And so just start to make plans in your own mind around how to reconfigure what you have, whatever you operate, in order to make it so that people can have more space. Similarly, maybe think about, we're almost certainly going to have to do some form of temperature checking. So you might want to think about that, how you would go about that. Think about how you would change your shifts of workers. Again, the world we're living in right now, we're supposed to be now being together with, hanging around with, working with the same 5 people every day. That principle, at some point it's going to be more than 5, but that basic principle is the same thing. You're always going to want to be physically with the smallest number of people as possible. So think about how you can arrange the shifts of your employees so people are with the fewest number of workers as possible. If you haven't already figured out how to do a better job with technology to enable for online ordering, online purchasing, online reservations, now's the time to do that. Call Commerce, 521-HELP. We've lined up a lot of tech volunteers who are willing to help you figure out how to do that, help you make a website, help you do an online reservation system, all that stuff. This is a great opportunity to think about how to tech enable your business, to enable people working from home wherever possible, selling things online, making reservations online. You really want to make those investments now. Think about cleaning. There's going to have to be whole new regimens around daily disinfecting. And you can read up on what's being suggested and how you might be able to do that. So these are just, I think it's a good question. I wish I had the absolute answer for you right now. We're still going through the work, but those are the kinds of things you should be thinking about, if only to get yourself in the mindset and your employees in the mindset of, living in a new normal. Final thing I'll say is, we're going to have to give people confidence. People are going to have some confidence to come out of their house and go shopping, come out of their house and go to restaurants. So the better you do of making your place of work safe, the more likely it is that people have the confidence to go there.
Our next question is from John DePietro. And John, just so you know, your question did get cut off, but I can read what's on the monitor. Governor, can you address unemployment insurance benefits requiring a buy code to certify weekly benefits? The codes have not been provided and no correspondence has been mailed in regards to eligibility. The call center does seem to effectively process calls.
I don't think I can answer that, but I will get the full question and get you an answer.
Next question is from Tanya Signori of the RI Echo. This is for Dr. Alexander Scott. If a surface has active droplets of COVID-19 on it, then within a 1-hour period, different objects touch it. This can happen 10 times or more. Does the virus then lose its potency? If so, can the virus eventually no longer exist on that surface?
So it's an interesting question, Tanya. We are still learning how robust and how sturdy the virus is. And so your question of, 10 times of different interactions, can the virus still be transmitted, is an interesting one. I will certainly say, because of droplet transmission and the concern that a virus can touch a surface, transmission can occur from that standpoint. And what is critical is the environmental cleaning that the governor mentions, and being able to do that on a regular basis. It does have a positive impact, regardless of how many people touched it or what the concern is in terms of the turnover, and the ability to cover someone's nose and mouth with the face cloth covering that we are referring to, and with our healthcare workers, the surgical mask. That helps minimize how much of the droplets that can spew out when someone is speaking or when someone sneezes or coughs. It helps decrease the amount of that then goes onto surfaces. So we know the importance of that type of covering, particularly in a healthcare setting. We know the importance of environmental cleaning, and we know the importance of hand washing. Implementing those measures does impact the virus from continuing on, and that's what I would focus on as a way to stop transmission of the virus.
Doctor, the next question is from Steph Machado of WPRI Channel 12. Researchers at the Cleveland Clinic say they found 15% of Abbott ID Now tests were false negatives. How concerned are you about this? How many of these tests are being done in Rhode Island daily?
So these tests that are referred to are our rapid tests. And it again translates back to the importance of everyone knowing, for all of the tests that we do on these specimens, it is most reliable and most accurate when it's done on persons who have symptoms. That is a key, and that element decreases the risk of the false negative percentage that is being referred to. We are aware of the concern. The tests that we have at our CVS sites that are rapid tests have been verified by retesting at our state health laboratory, and we did get consistent results on the initial set of tests that were done. And what we have with that is similar to what all states are using, and it's the best that we have. It's an important way we have to be able to expand testing. But because of that, we do talk about how to interpret the results. And as I just mentioned, we talk about getting the test obtained in the way that will decrease the risk of having those types of false negatives, because you're getting it with someone who has symptoms. But we also want people to be aware that once the test is obtained, if it's negative, if someone still has symptoms, they should still stay home and not go out if they are ill or sick with symptoms, to address any of the concerns that we have with test interpretation.
Next question is for the governor. Do you plan to follow Massachusetts and keep schools closed through the rest of the school year?
I haven't made a decision yet on schools. I will be making an announcement later this week. I am still consulting with teachers, parents, employers, mayors, superintendents, trying to gather public health officials first and foremost, trying to gather some more information about what the right thing to do is. It's a tough call. I will say this is a really tough decision. Our children deserve a chance to be able to learn and learn to the best ability that we can offer them. Having said that, it is difficult to imagine how we could safely allow 500, 600, 700, 800, 1,200 kids in a building at the same time in this environment. So we're working on it. I'll make an announcement later this week.
That question was from Elise Major of Providence Monthly. The following is from Ted Nisi. The majority of Rhode Islanders dying due to coronavirus are nursing home residents. How many are dying in their facilities? And are ventilators available there to treat them since they're not in a hospital?
Thank you. This is, a tough question. There's a mix in terms of where the unfortunate deaths are happening. Many are within the nursing home facilities, and a few are at hospitals in those settings. It is rare for us to have ventilators within a nursing home setting. Ventilators are one element of the entire care that's required to be able to have someone on a machine that's breathing for them. And it's primarily done within a controlled environment of a critical care unit in a hospital where someone can be placed on a ventilator. So again, this is a very challenging scenario because it is a very transmissible virus, particularly if it plays out in ways where you cannot tell the symptoms someone has that's leading to the transmission, and it's occurring in a population that is medically and physically fragile. And oftentimes in a nursing home setting, it's within a congregate setting where they are together. So it's something that, as I've shared, we're continuing to be as aggressive as we can. We certainly are working closely with the congregate care setting administrators and their staff, and want the families and residents to know that you are our top priority.
Very similar question to the one before, this one from Barbara Morris at NBC 10 News. We've heard from many people concerned about self-swabbing at the CVS drive-through site at Twin River. Some have ended up in the hospital with a COVID diagnosis after being told their test was negative there. Are you concerned about the false negative results?
This is something we certainly want to have happen as little as possible. It is something that we, as I shared, are doing our best to help address. We want people to know the aspects of the test, that certainly having symptoms is a key to get the best results. And we want to make sure that we can continue to follow closely. So if someone has a negative result, that they understand still staying home and recovering safely and isolating is important to do, regardless of if it's COVID-19 or another. And we're going to continue to follow the outcomes of these tests, and we will make adjustments if we need to, with continuing to assess the results.
Alan Gabberty of WBOB Radio asks, why are some COVID-19 deaths presumed? And what is the criteria for classifying a death due to COVID-19? How many Rhode Island deaths are presumed COVID-19 and how many are confirmed?
There are a few ways to address that. Early on, we were using the language presumptive positive because we needed the test that was newly validated by our state health laboratories, who did great work getting it going. CDC was repeating the same test, the Centers for Disease Control and Prevention, and that was what we led to going from a presumptive positive to a confirmed positive. What's being asked here is also similar to what I shared earlier. We will be updating our data reports to report people who unfortunately died on the day they died. There's sometimes a distinction between when that happens and when a death is actually confirmed as occurring, and it's less so that the death occurred, but usually the causes take some time to be able to confirm. So we are reporting deaths as COVID-associated deaths, which would identify if there was a positive test associated with someone who passed away. And there is no difference from that standpoint between a presumptive or a confirmed death from that standpoint.
And our last question today for this briefing is from Amanda Milkovits at the Boston Globe. What kind of illnesses are survivors suffering from after they are discharged? Kidney failure or other conditions?
So that's something that we are still learning nationally. Many people have spoken of anosmia, the loss of smell that has occurred with COVID-19 and the time frame that it may take for that to occur. We do know also that this illness is occurring more in people with underlying illnesses, so that may worsen some of the underlying illnesses in certain situations. So if someone had a kidney disease of some kind and were stressed by a COVID-19 illness, that kidney disease may persist or worsen. Outside of those types of associations, we're continuing to learn more about whether or not there are any long-term effects from COVID-19, but haven't been seeing anything prominently as of yet now.
Thank you very much.